Hello, I'm Dr. Venkatesan Chakrapani. I'm chairperson in Center for Sexuality and Health Research and Policy in Chennai. So I came here to talk on legal and ethical aspects of related to gender incongruence. So I think the term gender incongruence refers to incompatibility or say discomfort with one's perceived gender with that of the sex assigned to them at birth. So those people who call themselves as transgender or those whose self-perceived gender is different from the sex assigned at birth. So this transgender medicine is relatively new in India. So many endocrinologists they are concerned about like providing hormonal therapy for people who identify as who are diagnosed as having gender incongruence. So some of the ethical concerns people may have include like how we can maximize the benefits to the patients and minimize the harms. So one point like I discussed was about like if people are following the established guidelines like WPATH, World Professional Association for Transgender Health Guidelines, and there are other guidelines like Endocrine Society 2017 guidelines. These are very established and reputed guidelines. If they can able to follow that, we can be self-assured that we are actually maximizing the benefits for the patients and then minimizing harm to them. Sometimes people have asked me, like especially endocrinologists have asked me, I don't want to harm a normal body by providing hormones. So that is actually a misconception. If somebody is diagnosed as having gender incongruence, not providing, and if they are desiring for transition with hormones, not providing hormones is actually more harmful than what people think. Like by providing hormones, we are sorry. By providing hormones, we are actually harming them. So it is what is called gender affirmative therapy. By providing hormones which are consistent with the self-perceived gender, we are helping them in affirming their gender identity. So another ethical concern people may have is, for example, about what about the fertility options in the future. If we start providing hormones and if the person decides to have offsprings of their own, the genetic offsprings, then what are the options available? The Endocrine Society again talks about providing full counseling on fertility preservation, which includes gamete cryopreservation. You can preserve sperms or oocytes in cryo, so that's called cryopreservation. The problem is like this cryopreservation, the costs are quite high. Like maybe it may be up to like 50,000 rupees per year. So they have to keep maintaining that, keep giving that 50,000 rupees every year. So many people cannot able to afford this. So this is an affordability issue. And recently, there is, of course, very briefly about the legal issues also. Recently, the government has introduced one bill called Transgender Protection of Rights Bill 2019, which was passed in the Lok Sabha, and it is going to be maybe soon reviewed by the Rajya Sabha and maybe potentially approved. So what it says, this bill says, is there is a need to provide hormonal therapy and gender affirmative surgeries for transgender people. So it also talks about like medical insurance scheme, coming out with a medical insurance scheme so that they can able to cover this. So the concerns, it also specifically mentions about standard guidelines like WPATH. It names the WPATH guidelines, World Professional Association for Transgender Health Guidelines. So if the endocrinologists, they are going to follow the standard established guideline, they need not fear about the legal consequences. Yeah, I think so. I think the endocrinologist may need to update themselves about who are transgender people, what are the guidelines which are available to provide treatment to them, and keep themselves maybe, for example, they can even initially shadow some senior people how they are treating trans people, and maybe updates, periodic updates from say even the Endocrine Society of India, like conferences like this or any other capacity building workshops may also be helpful in actually increasing the competency of endocrinologists in providing hormonal therapy for trans people.